My name is Andrew Wolfe. I'm a board-certified plastic surgeon in Denver, Colorado, with a focus on cosmetic elective plastic surgery. One of the more common procedures that I do is facelifting. It's a procedure that's been around for a long time, but there has been significant evolution in how facelifts are done. And as we understand the process of facial aging, as we understand how soft tissue moves and behaves over time, I think we've gotten much more effective at tailoring procedures to match different types of patients. Not everybody needs a 5-hour large facelift, and in many patients that we see, they have milder signs of facial aging. There may be enough where they would benefit from some type of lifting procedure, but they don't need something particularly aggressive. And so one of the procedures I do a lot of is called what we affectionately call a mini-facelift, and it is a scaled down standard facelift. It's got shorter incisions, it's got areas of undermining which are reduced in size, and so basically it's a smaller version of a full facelift. It works very well in patients who have jowling, cheek laxity, and some neck laxity. It does not work as well for patients who have really significant either muscle or skin laxity in the neck. So somebody who comes in with a big turkey gobbler neck still needs what is ultimately going to be probably a full facelift, but for patients with less significant signs of facial aging, we make smaller incisions around the ear. We are lifting up each cheek individually, but because the muscle is tightened very vigorously in a vertical direction, because the skin is tightened as a second layer of tightening, you can take what are fairly significant degrees of facial laxity and correct them with a smaller procedure. And so now instead of a 5 or 6 hour surgery, you may have a 2.5 hour procedure. The recovery is also significantly reduced because you've got less surgical space that's affected by surgery, significantly less bleeding, less chance of soft tissue injury, less chance of wound healing issues for the skin itself. Typical results, most patients will have some bruising at the end of a week, typically a small amount of bruising localized to the jawline area, but once the sutures come out at a week, we find that a lot of patients can really resume milder social activities, and by 2 weeks, most patients are back doing just about everything. It's really nice to have something that's a smaller procedure where you can target a younger patient population or somebody who's got less facial aging, and then reserve the more aggressive facelift for someone who really needs a more significant procedure.